Filippo is the president of the European Federation of Periodontology, and he is here at the SEPA 2019 Congress with quite a provocative presentation entitled "Is Periodontal Surgery Still Necessary?" Now, if the answer to that is no, then you're taking us right out of the jazz age, aren't you?
No, well, the answer is surely yes. We still treat a chronic disease, a chronic inflammatory disease, with surgical approaches. Do we need to do surgery all the time? Not at all. Most probably we are moving from a periodontal treatment that classically involves surgery the majority of the time to very likely a situation where perio-surgical treatment is done less and less. To give you an idea, in 2004, when I just graduated with my perio master and I came back to Pisa, I did more than 1,000 surgery in 1 year. Then it will take me 3-4 years to get to the same amount. So we do less and less surgery. And the reason is that we're more efficient with our non-surgical treatment. We take our time to evaluate, so we'll let the patient heal properly. And at the same time, we also have clear when we should do the surgery. So maybe we were a bit over-treating before. But I think it's also a fact that the surgery per se is changing, the techniques are changing. Now, some hopeless teeth can really be, we can really change the prognosis of hopeless teeth, which is very good, because the newer technique allows us really to achieve reconstruction or regeneration even of very complex defects. But the end point is that we do less surgery. When we do it, it's more complicated. But in some cases, surgery is absolutely needed, and when it's needed, it has to be done properly, and correctly.
But for the more complicated surgery, technology is always being developed.
Yeah.
So it sounds like you're putting the health of the patient much more at the forefront.
It is. In fact, to me, what I tried to highlight was the indication for surgical treatment. And you see, we have so much knowledge on non-surgical treatment. Paradoxically, we lack a lot on surgery. We don't really have the same basis in terms of knowledge in clinical trials. And to clarify, the indication for non-surgical treatment is not easy. For surgical treatment is not easy. The point of my speech was to define the indication for surgical treatment all the time that a second session of non-surgical treatment would have failed. Namely, the point is that we would favor keep on being non-surgical for the sake of the patient, economically, in terms of morbidity and so forth. So only when we know that the second session will fail, that will translate of having indication for surgery.
Well, Filippo, you're also in a position to judge with some perspective the trajectory of SEPA over the years. You've been working with the leaders of SEPA for many, many years in international workshops. This is a congress now with just over 6,000 people.
Yeah.
Every congress is bigger. What have you seen over the years as SEPA has grown?
What I saw in SEPA is something that I could see in all the societies of perio in Europe. Periodontology is growing. And by growing, I meant to say that the attention towards perio is changing from not the population and the patient. I'm talking about the general dentist and the hygienist. So periodontology is becoming attractive. And that's very important, because before we were in a sort of a niche, whereas now it's something that the people would like to know more.
Attractive within dentistry?
Yes,
you mean,
yes, within dentistry, I'm saying. It's becoming a hot topic in dentistry. That means that 10 years ago you would have run to see Congress where you could learn how to place a screw, whereas now it's normal that people will come to a Congress to understand how to save teeth. So this is, I think, the first point. It's a general phenomenon. Secondly, there is a lot of freshness and youth in the societies, and that really made a point. And I'm proud to say that, I'm the president of the European Federation of Periodontology, but I belong to a newer generation, of course, which is exactly the same generation of the leader of SEPA, because Adrian and myself studied together in London. You know, we were classmates. So for me, there is the pleasure of being here now, focusing on SEPA. Is not just the tremendous success of the Congress, it's also to share the moment with David Herrera before and now Adrian, that are both two very good brothers of mine, really. Now, SEPA have managed to ride the wave of these changes and also to lead these changes. And I think the main reason behind is that they thought out of the box, and they worked really a lot. And for that, it has to be acknowledged what they've done, and it is very clear to me, and I think it's in front of the eyes of everybody.